failure to heal, degeneration, under eye circles, arthritis, macular degeneration. I get macular degeneration letters every day. All of these are signs of dirty blood, toxicity. This is the theme that runs behind, the thread that runs within all health issues, dirty blood. No matter what it is, a skin issue, internal issue, blood pressure issue, heart issue, autoimmune issue, dirty blood. And by the way, if you've been given an anti-inflammatory drug for any health condition that you have, and that includes prednisone and Motrin and naproxen, if you've been given an anti-inflammatory drug, you can rest assured that your symptoms are related to stress, because that's what inflammation is. Inflammation, swelling, fluid accumulation, these are all the manifestation of a stress response. So if you've been given an anti-inflammatory for your health challenge, guaranteed you have some kind of burden on the body. If you hear the word immunity, as in autoimmunity or immune disease, guaranteed you've got some kind of emergency in the system, inflammation, degeneration. If these are part of the name of your so-called dis-ease, if it has the word degeneration in it, as in macular degeneration, or if they've given you an anti-inflammatory drug like prednisone or Motrin, or if you hear the word immunity in your health issue as an autoimmune problem, you've got a burden, a stress, an emergency in the system. And the intelligent, non-medical thing to do, intelligence and equals non-medical, the intelligent, non-medical strategy is to figure out what the heck is getting into the body. And when we talk about getting into the body, when we talk about the body manifesting an emergency response, a survival response, a stress response, we're talking about the blood. And whenever we say something is getting into the body, what we mean is the blood. And this is what's behind everything, you guys. Everything that involves a degenerative condition, chronic degenerative disease, which is the vast majority of our health challenges. It all has to do with a body that is trying to protect itself. It's trying to get by. It's a sign of the stress response. And this is the secret of healing that your medical professional doesn't tell you because he doesn't know. Well, probably because he doesn't know. It could be he doesn't want to tell you, but probably he doesn't know. In the realm of chronic degenerative disease, the vast majority of our health concerns, not infections here. I'm not talking about infections. I'm not talking about trauma. I'm talking about chronic degenerative disease, diseases that just progressively get worse, that don't heal. Doctoring is about assessing sickness and then managing it. It's not about returning the body to a healthy state, because that's not medicine's job. The part that gets me mad, and why I sometimes get a little bit, angry here on the program and when I'm doing my talks, is because doctors pretend to know. And they're arrogant about it. And the medical model is chauvinistic about it and attacks viciously anyone who says something different. You can go to jail for saying something different if it regards cancer. There are people in jail because they said something different or opposing the medical model. There's even doctors in jail because they had the nerve to go against the standard medical dogma when it comes to cancer. Disease is a lifestyle issue, and it's our business, chronic degenerative disease, even cancer. Okay, so we're talking about hyperpigmentation, melasma, dark spots on the skin. Very common complaint, very frustrating complaint. Doctors have a tough time dealing with hyperpigmentation issues because once the pigment's on the skin, you guys, it's over. The trick to taking care of pigmentation issues is to take care of the stuff that's coming up tomorrow. Now, you can use some topical products that will help reduce hyperpigmentation, but like all skin issues, dark spots, melasma, hyperpigment, all are about an internal condition. And all internal conditions, in turn, are about dirty blood. There's nothing the medical model can do. In fact, drugs just make the blood dirtier, and surgeries just create more of an emergency response. How ironic that our medical strategies for taking care of the body make the body worse, with the exception of antibiotics for infections and stitching people up for emergency trauma kinds of issues. All our strategies, ALL, all our medical strategies, capital A-L-L, all our medical strategies for dealing with chronic degenerative disease make the body worse. This is not me just saying this. This is logic. The body now has to process toxins. You've suppressed chemistry. You've stopped the body from doing what it needs to do. How can that ever, ever, ever be in our health interest? Do you need emergency medicine every now and again? Yes. Am I thrilled that we have pain pills available to us? Yes. I keep Percocet in my medicine cabinet, and I recommend everybody does. You never know when you're going to need some pain pills, so praise God for pain pills. You never know when you're going to need an antibiotic. It's a good thing we have them. But for chronic degenerative disease, your beta blockers, calcium channel blockers, diuretics, anti-inflammatories, immune suppressants, these all make the body worse. How can a medical professional who's sworn to take care of us, to help us, who takes money for it, use these kinds of strategies? Now, when it comes to the creation of degenerative disease, doctoring can't do anything about it. As Dr. Andrew Weil reminds us in his book, Spontaneous Healing, when it comes to degenerative disease, no cures are possible. And he's right. Of course, cures aren't possible because degenerative disease is about a breakdown process. The only way you take care of a degenerative disease, you don't cure it, you reverse it. You troubleshoot it. You reverse engineer. I was talking to an engineer yesterday on the phone who had a health challenge. I love talking to engineers because they understand what I'm talking about. Well, we can all be engineers. You don't have to have a four-year degree. You can all understand the process of engineering and reverse engineering. You work backwards. If we're degenerating, all we got to do is figure out why we're not regenerating, because the body's regenerative under healthy conditions, and it's always going to involve an element of survival or a stress response. Nutritional deficiency, that causes a stress response. Lack of oxygen, that causes a stress response. Mental and emotional issues, stress response. Toxicity, stress response. Sugar, stress response. Did you guys catch this latest thing from Coca-Cola? This one cracks me up. Coca-Cola funded research to show that it wasn't sugar that makes you gain weight, it's lack of exercise. Great. Sugar's no problem. Listen, sugar is an issue because it causes an emergency. Obesity is a manifestation of the stress response. If you can't lose weight, and you've done everything you know to do to lose weight, and the pounds just aren't coming off, you got a body that thinks it's protecting you from a famine. That's why we can't lose weight when we try. Now, a lot of people, they're obese, and they've done all the dietary strategies and taken the medicine. They've done everything they could do. They're resorting to, with the complicity of their medical professional, cutting themselves up, stapling their stomach, because they just can't figure out how to lose weight. Well, guess what? If you can't lose weight, you got a classic sign of the emergency response. Pack that up in an envelope and mail it to your doctor. Tell him what I just said and see if he can deny that. Obesity, weight gain are one of the ways the body protects us. It's one of the ways the body survives itself, survives famines. Well, there's no famines, but the body doesn't know that. Nutritional supplementation is important not in a this for that way. Not so much, I got this problem, what supplement do I take? This is the kind of letters I get all the time from folks who haven't heard this program or heard my presentations. They're under the impression that you do something called allopathic nutrition. Allopathy is Latin for against disease. Allopathy is the way the medical model works. It fights disease. There's a commercial now for all these people talking about how cancer is an enemy, and cancer, you're not going to do this to me, as if cancer is somehow the outside coming in and attacking us. We have a model that is a wartime model. We have wars for everything. We got wars against cancer. We got wars on drugs. We got wars on terrorism. We got wars everywhere because we have a model where everything is fighting everything else. The way you take care of disease is you don't fight disease. You reverse disease. You work backwards. The reason nutritional supplements are important is because they help the body get strong again, not because they cure disease. Every once in a while, there'll be these studies that come out where doctors or scientists or researchers will use omega-3s for heart disease, and they'll say, omega-3s don't work for heart disease. We proved it. Magnesium doesn't work. Or I'll have other people, doctors or people who know a little bit of health, they'll say, well, where are the studies that show omega-3s help with heart disease or with anything else? That's not how it works. Supplementation is important because we're not getting the stuff in our food that's supposed to run our bodies. We make the body healthy with all these strategies we talk about here on the bright side. The body cures disease. God cures disease. The divine force cures disease because that's its nature, to heal and regenerate. The secret to why we don't heal, even though we got more doctors per capita than any other culture in the history of mankind, more drugs available to us, more fancy schmancy diagnostics and surgical procedures, and we all have our Obamacare and our insurance, but we're still sick. We're still dropping dead of diseases after 6 decades of life. Most of us, many of us anyway, get 60 or 70 years. That's so sad. That is so tragic. And then we rot the last 30 years. That's even worse. The reason we don't access or leverage our 120 years of God-given existence, Doc Wallach says 150 years, but it's certainly more than 60 or 70. And the reason we decay the last half of it is hidden. Despite the fact we have all these doctors, it's hidden in the very word disease. Dis-ease, lack of ease. It's hidden in the word. It's hidden in plain sight. That's the way the models work. That's the way the disempowering paradigms, all of it, government paradigms, political paradigms, legal paradigms, medical paradigms, they all work by taking things that are the truth and the facts, and they hide them in plain sight. The secret to reversing disease is hidden in plain sight. It's right in the word. Dis-ease. How do you reverse disease? You go back to ease. And that's where nutritional supplementation and oxygenation and moving and mental strategies, emotional strategies, and spiritual strategies come in. All right, I'm Pharmacist Ben. You're listening to The Bright Side. We'll be back right after this. Don't go away. Okay, we are back on The Bright Side. I am Pharmacist Ben, talking skin lightening, not just as it involves skin itself, but as it involves the internal milieu, the internal condition of the body. If you're dealing with hyperpigmentation issues, you more than likely are dealing with stress hormone cortisol issues, female hormone / stress hormone estrogen issues, adrenal health issues, digestive issues, and blood sugar issues. Nobody just has hyperpigmentation. This is so important when it comes to the health of the body. Nobody just has one health condition. We may notice it in one part of the body, but the body breaks down as a system. It's a field. It's a system in the sense that all the parts are connected. I got a call or a letter a few months ago from a gal whose husband had polycystic kidney disease, and I gave her a whole program. I told her, she says to me, and I hear this all the time, oh, he's perfectly healthy, but he has polycystic kidney disease. Everything else is fine. And we think this. We think everything else is fine, but we just have polycystic kidney disease. Folks, that's impossible. It doesn't occur that way. And this poor misguided woman who's trying to take care of her husband, who's deluded into believing her husband's perfectly healthy, but he just has polycystic kidney disease, is now forced to go to the doctor and to deal with the medical model so that she can have the kidney addressed. I hear this all the time. I got Parkinson's disease, but otherwise I'm perfectly healthy. You can't be perfectly healthy if you have these kinds of conditions. And this is not to say that I'm not trying to beat anybody up. I'm just saying if we want to address the condition of our brain, if we have Parkinson's disease, or the condition of our kidneys, if we have polycystic kidney disease, or the condition of our skin, if we're hyperpigmenting, we've got to address the field, the system, the entire body, which is one unit, which means if you got a kidney problem, you got a body problem. If you got a brain problem, you got a body problem. If you got a skin problem, you got a body problem, and you have to address the body. And then the skin will resolve itself, the kidney will resolve itself, and the brain will resolve itself. This is so fundamental. And it's such good news because it liberates us. It emancipates us from a reductionist model that thinks that all the parts of our body are somehow separated. They're not. They're connected by an invisible underlying field. And by addressing that invisible underlying field with just basic, simple lifestyle strategies, changing the way we eat, changing the way we supplement, changing the way we breathe, restricting the amount of sugar that we eat, relaxing the body, all of these simple, basic lifestyle strategies that have nothing to do with the medical model. Once we start to incorporate these, not only will we be liberated from the medical model, not only will we be emancipated from Obamacare and from our prescription drugs and from strategies, medical strategies that butcher us and ablate us and destroy us and poison us, but we will truly, really get better the divine way, the divinely mandated way. Because at the end of the day, folks, the body is a healing and regenerating system. Let us show you how simple and easy this can be. 844-236-6010 is our number. I'm Pharmacist Ben. You're listening to The Bright Side. Welcome, Michael from Washington. What's going on, buddy?
Yeah, thanks for taking my call again. I called yesterday. I want to get really to the point here so I don't hog the whole show. For the last 5 weeks, I've had severe pain in my hip, minor pain in my back. I couldn't get in to see my doctor, so I went to a chiropractor for the first time. They sent out for images on my condition, and then they brought me back and said I had degenerative arthritic spine disease. and then they showed me that I had severe disc, osteoporosis, spurs, the whole 9 yards. So,
how old are you, Michael?
I'm 65.
Okay, yeah, I remember talking to you yesterday. Here's the deal, Michael. You don't necessarily, yeah, your spine is degenerating, and you got the osteoporosis. I don't want to address that. What I want to tell you is, from a healing perspective, you only need to know one thing. You don't need a chiropractor. You don't need a doctor for any of this stuff. You only need to know one thing. You ready for this, Michael? Your body is falling apart. You're melting, you're dissolving, and all you got to do is figure out why this is occurring, because this isn't the way the body operates. The body's a regenerating system, and you are degenerating. So something is interfering. You follow me? I want you to see how we're working here logically, not just for you, but for all the listeners. Your body's a regenerating system, but you're degenerating, so something is interfering. And there's only two ways this interference can develop. Either something is getting into the system that shouldn't be, or something is not getting into the system that should be. You follow me? The wrong stuff's getting in, and the right stuff is not getting in. So let's address this from both angles. First of all, how does the wrong stuff get in? Well, if you were injecting heroin into your blood, or you were using vaccines, or somehow bypassing your skin barrier and getting right into the blood, then that could be a problem. But you don't sound like you're doing that. So there's only one other way. And you could be breathing it in too, but that's minor. For the most part, things get into the blood. The wrong things get into the blood through foods and digestion. So, and I'm going to tell you how you do that in a second, but I want that to make sense to you. The wrong stuff gets in through the digestive system, through the intestine. So far, so good?
Yes.
Okay, this is for everybody listening now, not just for Michael. If you are degenerating, but we know the body's a regenerating system, the wrong stuff is getting in and the right stuff isn't. Part one, the wrong stuff getting in, 99.9% of the time, it's coming in through the intestinal barrier, through the digestive system. That means food and digestion, period. The second phase, or the second compartment, or the second aspect, if you will, the second category is the wrong stuff. The right stuff is not getting in, and that's your Mighty 90 essential nutrients. So between eliminating the wrong stuff getting in and putting the right stuff in, this thing can begin to reverse. It has nothing to do with a chiropractor or a doctor. So step number one, you want to do a food diary and start to notice when you have digestive symptomology. When you're eating the wrong foods and stuff is getting into the blood and that shouldn't be getting in, you'll feel it. You'll either be constipated, you'll have diarrhea, you'll have loose stools, you'll feel bloated, you'll feel crampy, something. You follow me, Michael?
Yes.
And the problem is, symptomology tends to diminish. We don't notice it as much over the course of time. So if you're 65 and I'm not saying this is true, but if it is, just in case it's true, if you've been eating the wrong thing for 60 years or 65 years, you're not going to notice it. When you're crampy or you're bloated or you're constipated, it's just going to go under the radar. The brain kind of turns down the volume on things that occur over and over again, especially over the course of years and decades. So you have to write it down. Write down everything you eat, and then write down how you feel an hour, 2 hours, 4 hours, 6 hours, 8 hours, 12 hours later. That's called a food diary. And it'll help if you're up for it. If you fast for 2 or 3 days, that will make you more sensitive to the results, to the effects of certain foods. You'll notice it more. So you may be just for hypothetical sake, you eat bread, right? And you're crampy and bloaty, but because you've been doing it all your life, you don't notice that you're crampy and bloaty after you eat bread or cereal, let's say. But if you fast for 2 days and then eat bread, all of a sudden that crampy or bloatiness is going to become much more exaggerated. You're going to notice it more. You follow what I'm saying? If you clear the decks and then reintroduce, you'll become more sensitized to the symptomology, the effects of certain foods. The next thing you want to do, so that's a food diary and then eliminate problem foods. Step number one. Step number two is you have to start to strengthen the digestive lining, the intestinal lining, and there's lots of ways to do it. Now, I'm going to tell you some strategies, and it's not even going to make sense to a lot of folks who haven't listened to this program before. You're going to say, well, Michael has a back problem, he's got a hip problem, he's got a bone problem. What do probiotics have to do with that? Well, they have a lot to do with it because good bacteria help strengthen the integrity of the digestive lining, keeps problem foods from getting into the blood, reduces inflammation, reduces the immune response, so now your body can start to heal itself. And that's just one example. So food diary, food elimination, get yourself on the Biolumin Nightly Essence, 3 capsules